Assalamu alaikum. Welcome to General Science class 9th. The name of the chapter is Microorganisms and Diseases, and today we are going to discuss the second week's topics. I hope so you have well prepared the topics which were discussed in week number 1, and you have also done the written assessment which was given with it. In previous week, we discussed two main topics. The first topic was microorganisms, and the second topic was a disease, tuberculosis. Microorganisms are small microscopic organisms which are not visible to our naked eye. We must use a microscope to see them. The disease which we covered was tuberculosis. It's a disease which is caused by a bacteria. The name of bacteria is Mycobacterium. The common symptoms of this disease are chest pain, blood and sputum, prolonged coughing, constant fever, and loss of body weight. There are certain methods by which we can control the spread of this disease. Some of them are proper food, fresh air, and proper rest. The victim of the disease should be kept in isolation or sanatorium. The disease is curable, but prolonged and persistent treatment is must, and infant must be immunized with BCG. It's the name of a vaccine against TB. The objectives for this lesson are: by the end of the lesson, the students should be able to classify the disease as viral or bacterial, explain the difference between TB and whooping cough, categorize the disease into congenial or non-congenial groups, describe the symptoms and precautions of each disease, identify the method of spread of each disease, apply their knowledge of science for identifying disease, and accurately name the disease caused by bacteria. Today, the disease which we are going to discuss is whooping cough. It's a disease of respiratory system. First of all, we'll discuss the causes. Its name is whooping cough, as well as its name is pertussis. Pertussis is a respiratory illness commonly known as whooping cough. It's a very contagious disease. What is the meaning of contagious? It means it can spread from one living organism to other living organism. It is a contagious disease caused by a type of bacteria called Bordetella pertussis. These bacteria attach to the cilia. Now, first of all, discuss what are cilia. Cilia are tiny hair-like extensions that line part of the upper respiratory system. The bacteria release toxins or poison which damage the cilia and cause airways to swell. When the airways got swollen, they are not able to perform their proper functions, and when these airways are swollen, they cause pain and they cause coughing, and this disease is known as whooping cough. Now you can have a look on the diagram. This diagram is not given in your book. Of course, this diagram is not included in your syllabus, as well as it won't come in your exams, but this diagram is only meant to make your concept clear. Can you see the epithelial cells? They are the rectangular cells, and you can see the tiny hair-like extensions. These tiny hair-like extensions are cilia. Now you can see what is between a diseased cilia. You can see these are the normal cilia, and these are the diseased cilia. In these cilia, bacteria has attacked, and these bacteria has produced poisons. Can you see the purple colored poisons? Now these are the cilia which are diseased one, and these are the cilia which are normal. Normal cilia are capable to show movements, while these diseased cilia they are not so much able to show free movement. So these bacteria cause the epithelial cells to swallow, cause pain, and cause coughing. How can this disease spread? The whooping cough bacteria are spread from person to person in airborne droplets by coughing, by sneezing, or by direct contact. Once infection with the whooping cough bacteria has occurred, the time until symptoms appear is usually between 5 to 10 days, but can be up to 21 days. The common symptoms of this disease are a runny nose, sneezing, a low-grade fever, fatigue, a mild cough, watery nose. How can we prevent ourselves from this disease? We can prevent ourselves by keeping distance from the person who is having this disease, and by getting vaccinated. Keep babies and other people at high risk for pertussis complications away from infected people. Two vaccines in United States help prevent whooping cough, that is DTaP and TDAP. Babies need 3 shots of DTaP to build up high levels of protection, while the young children need 2 booster shots. And then there are the age limits which are given for each shot. The next disease which we are going to discuss is diphtheria. Diphtheria is a serious problem in current days. It's also a bacterial disease. This disease attacks the mucous membrane. What is mucous membrane? It is a membrane inside our it is a membrane which is a part of our respiratory system, and it produces mucus. Mucus is a substance that traps the harmful that traps the harmful microorganisms or the harmful particles which enter inside our respiratory system. It's a bacterial problem that affects the mucous membrane of the throat and nose. It is a contagious disease. It means it can spread from one person to another person, but still it can be prevented through vaccines. Diphtheria must be treated as soon as possible because it can seriously damage your other organs, kidney, liver, and heart also. Common causes are it is caused by bacterium Corynebacterium diphtheria. This disease can be spread from one person to another person through common belongings such as cup, used tissue. And when you are sitting around any infected person, when they sneeze or cough or blow their nose, then you are also affected. And if bacterial infection is not visible in them, then also they transmit infection for up to 6 weeks. Common symptoms are um, gray coating on nose, throat, tongue, and airways. It creates toxin that can affect many other parts of the body, such as heart, brain, and lungs. Other visible symptoms of diphtheria are fever, chills, swollen glands, a loud barking sound, a sore throat, blush skin, and the patient may feel difficulty in breathing or swallowing, and one may also feel shock such as pale and cold skin, sweating, and heart start beating rapidly. How can we prevent ourselves from this disease? We can prevent ourselves from diphtheria by use of vaccines and antibiotics. Doctors also advise a single shot of DTaP along with vaccines for pertussis and tetanus. It is recommended for the children at age of 2, 4, 6, 12 to 18 months respectively, and also of 4 to 6 years. Tetanus is a serious disease caused by a bacterial toxin that affects your nervous system, leading to painful muscle contractions. It means you are not able to contract or relax your muscles easily, particularly of your jaw and neck muscles. Tetanus can interfere with your ability to breathe and can threaten your life. Tetanus is commonly known as locked jaw. It means your jaw is locked and you are not able to perform the movement of your jaw easily. Common causes are it is caused when the Clostridium tetani bacteria enters the body through any deep wound or skin injury, spread throughout the body and produce a toxin called tetanospasmin. This toxin is a poison that blocks the nerve signals for your spinal cord to your muscles. This can lead to severe muscle spasms. These bacteria are mostly found in soil, dust, and animal feces. This infection has been associated with burns, puncture wounds from piercing, tattoos, or injecting drugs, animal bites, wounds contaminated with dirt, feces, or saliva, dental infections, insect bites, or chronic sores and infections. Common symptoms of this disease are fever, high blood pressure, muscle spasms, lockjaw, sweating, and difficulty swallowing. We can prevent ourselves from this disease by taking booster shots on schedule. Immunization can also help preventing the effects of the toxin. The primary vaccine series of tetanus vaccine usually is given to children as a part of diphtheria and tetanus toxoids and DTaP vaccine. This vaccine provides protection against These three diseases, a throat and respiratory infection, that is diphtheria, whooping cough, and pertussis, as well as tetanus. Typhoid fever is a serious bacterial infection that easily spreads through contaminated water and food. It means it is basically this disease is related to hygienic conditions. Along with high fever, it can cause abdominal pain, headaches, and loss of appetite. With treatment, most people make a full recovery, but untreated typhoid can lead to life threatening complications. Common causes of typhoid are fecal oral transmission route. This means that Salmonella typhi, the organism that caused this disease, is passed in the feces and sometimes in the urine of infected people. You can contact the infection if you eat food handled by someone with typhoid fever who hasn't washed hands carefully after using the toilet. You can also become infected by drinking water contaminated with the bacteria. Common symptoms are fever, weakness, headaches, etc. We can prevent ourselves by avoiding food that is raw or uncooked, by vaccination, by drinking only bottled water or water that has been boiled, thoroughly washing hands, avoiding raw fruits and vegetables, and avoiding eating foods and beverages purchased from street vendors. The next disease is cholera. Cholera is an infectious disease that causes severe watery diarrhea, which can lead to dehydration and even death if untreated. It means this disease is basically a watery diarrhea, and in the form of watery diarrhea, we basically lose a large amount of minerals and salts from our body. It is caused by eating food or drinking water contaminated with bacterium called Vibrio cholerae. Common causes are the bacteria that causes cholera is usually found in food or water contaminated by feces, and the name of this bacterium is Vibrio cholerae. It is caused by municipal water supplies, ice made from municipal water, foods and drinks sold by street vendors, vegetables grown with water containing human waste, raw or uncooked fish or seafood. Common symptoms are low blood pressure, vomiting, increased thirst, rapid weight loss, diarrhea, and loss of skin elasticity. We can prevent ourselves from this disease by drinking bottled water, using safe water, which is boiled or either clean, and clean food preparation areas and kitchenware with soap and safe water and let dry completely before reuse. Treatment is rehydration, IV fluids, which are injected through IV line, antibiotics, and zinc supplements. This is all for this week's lessons. Hope you enjoyed the lesson and thoroughly understood the concepts. You can easily contact your teachers if you found any difficulty in that topic. Thank you very much and Allah Hafiz.